Yep, this is me. You're probably wondering how I got here. So, story time. I went live on YouTube to showcase my quads and hamstrings workouts. During the process, I did my warm up as usual, and I started with my first set. I was in the Smith machine. Mind you, I don't usually use the Smith machine. I used the normal squat racks. This time I decided to use the Smith machine because it's kind of in a secluded area in my gym. So people are not going to be passing through the video. I was trying to avoid that. So that's why I use that Smith machine. I don't typically use it. So I went there, I was using it, and then I did my 20 kg warm up set. I went to 40 kg. And when I went down, I had a pop. Like I had this car sound in my knee. It was loud, at least to me. And then I came back up. I'm like, my God, my God. I knew that something was wrong. I went to the side and I was telling my workout partner that something is up with my knee. At first she didn't believe me. She's like, okay. Because I've never had any gym injury before. I've never had any problems with any part of my body. Just the usual soreness after you work out. But this time was different. I just went to the side and I started like trying to see what's up with the knee. And I felt some pain. The pain wasn't so severe immediately. The pain was a gradual build up. I didn't feel that amount of pain just yet. But I knew that my knee wasn't stable. It wasn't normal anymore. It was kind of shifty and I couldn't put weight on it because it was feeling weird. Then two other guys came around to help me, ask what's wrong, and they were giving some massages, trying to just do something about it. After that, I went to climb the treadmill to just see what's going on with the knee. And after I spent like less than 1 minute on the treadmill, I came down. I'm like, nah, I'm going home. So I carried my bag, we went home. Next day, I went to a lab. I did an MRI. The report showed lateral collateral ligament tear with effusion because there was a swelling in my knee. The swelling was not immediate. By the next morning, there was a swelling in the knee. So there was an effusion. In layman's there's a collection of fluid there in the knee. I went to the hospital on Monday, saw the doctor, did assessment. He said it is more of a meniscus tear. Now, this is the part where we discuss anatomy of the knee, just so that you can understand what I'm talking about with all these ligaments, meniscus, and you're not confused, so that you're carried along with my story. Let's get to it. The knee is one of the largest and most complex joints in the body. It carries your entire body weight, absorbs shocks during movement, and allows for straightening, bending, twisting, all of that movement. And because of all this action, this is why the knee is the most commonly injured part of the body, especially in athletes. The knee joint connect three bones: the femur, the patella, and the tibia. And these bones come together to form a hinge joint, but not just a simple hinge. Now, moving to the ligaments of the knee. A ligament is a connective tissue that connects bone to bone. There are four major ligaments in the knee: the anterior cruciate ligament, there's the posterior cruciate ligament, the lateral collateral ligament, and the medial collateral ligament. Now, talking about each one of these ligaments and their functions. Anterior cruciate ligament prevents the tibia from sliding forward. It also provides rotational stability, and it is commonly injured in sudden stops, cutting, pivoting, landing from a jump, and these are movements that are common in sports, which is why it is the ligament that is most commonly injured in all these athletes, especially footballers. I'm sure most people are aware of this. Posterior cruciate ligament prevents the tibia from sliding backward, works with the ACL to stabilize the knee front to back, and it is commonly injured when there's a direct blow to the front of the knee or falling on a bent knee. Moving on to the medial collateral ligament, the MCL. It runs along the inner side of the knee. It resists forces pushing the knee inward, and it is commonly injured when there's an impact from the outside, like a side tackle in football. Finally, the lateral collateral ligament is found on the outer side of the knee. It resists forces pushing the knee outward and commonly injured when there's a force from the inside of the knee, sudden twisting, or lateral movement, which is what I believe happened in my case. I don't know, I can't really say because it's not like I was twisting and turning while I was squatting. No. So I can't say for sure, honestly. Moving on to the meniscus. These are the cushions. Each knee has two meniscus. Each knee has two meniscuses, menisci. One, the medial and the lateral. Obviously, the medial is on the inside and lateral is on the outside. The meniscus acts as shock absorbers. It helps distribute body weight across the joints. It aids in stability and smooth movement between the femur and tibia. And meniscus injuries are common with twisting motions, especially when the foot is planted and the knee is bent, like in squats, lunges, or even turning too fast. So, again, I believe this is what happened in my case. Moving on to the tendons. Tendons connect muscle to bone. The key tendons in the knee includes quadriceps tendon and the patellar tendon. Tendon injuries usually occurs due to overuse, poor warm-up or muscle imbalance, and direct trauma. Example is the patellar tendinitis, also known as the jumper's knee, which is more common in athletes. So you see that a lot of these injuries in the knee is common with people who are active. Example, me. So there are other supporting structures in the knee, like articular cartilage, the synovial membrane, the bursae. These generally just help to lubricate the knee, to prevent friction. So now when you think about it, the knee is actually doing a lot. It is basically carrying the weight of your life. And this is why it is important for you to know about your knee, to know how it works, especially if you are someone who trains regularly, you are an active person, you're someone who's getting older, you are obese, just have to learn just to know all of this. Now that you understand the science, let's get back to the story. I went to the doctor and he asked me questions about the injury. So did examination, looked at my knee, did all the tests, and then looked at the MRI as well. So he came to the conclusion that it is more of the lateral meniscus injury. The MRI picked up the LCL tear, probably because of they're both in the same anatomical position, and it might just be a strain on the LCL, but it is actually the meniscus that is the problem. And a meniscus tear can sometimes present with similar symptoms of an LCL injury. So all the swelling, the joints clicking, instability, they're both symptoms of the LCL tear and the meniscus injury. So this is why they look similar. But however, from his own observation and all, it is more in line. It is in keeping with meniscus injury, the lateral meniscus injury. Trauma affects both. This is why it is easy to mix both of them, but at the end of the day, the clinical diagnosis trumps that of the imaging. So basically, that's what happened to me, and now I am focused on recovery. I have to stay away from workouts, maybe not upper body, but I have to stay away from lower body. And even if I'm doing upper body workouts, it might have to be seated to avoid putting any strain or any stress on this leg. And I have to use crutches now just so that I can avoid bearing weight on this knee. It is super important that the knee gets all the rest it needs. Also, it was recommended I use ice compression just to bring down the swelling. So I'm going to start physiotherapy next week. I can't wait really because I really just want to get back. I also have to wear this brace. I have to wear a knee brace to stabilize the knee. I'm going to be filming my journey and my recovery process. I hope you guys join me in my journey. Anyway, if this is something you've gone through, you can let me know in the comment section. And you can just show me your love and support by liking this video, leaving a comment, and subscribe to my channel. Yeah, the moral lesson is that you should pay attention to your body, I guess. I don't know. Be careful while you are working out. Don't do too much. I wasn't even doing too much. Bro, my PR is 100 kg and I was squatting 40. That's like super lightweight for me. How can why? Just why? How can that be the reason why I get to stay away from the gym? That small thing. God. That's okay. It's okay. But it's all good. I'm recovering. I'm going to do everything possible. I'm listening to doctor's advice, the physiotherapist's advice. I'm going to do everything possible to get back on my knees as soon as possible. I can't even kneel. I can't walk without limping. I cannot squat. And if they ever recommend that to me, no, squat is out of my program for good. I'm not doing that anymore. It was so scary when it happened. It's the sound that my knee made when it happened, the pain, the inability to move after, everything just was a lot for me. So yeah, I'm going to be putting you guys through my recovery, the workouts I'll be doing, my physio, everything. So come along with me in this journey. And to do that, you have to subscribe, like this video, and leave a comment. Thank you for watching. I will see you guys in the next one. Bye.